Mid-systolic, non-ejection clicks. Clicks are high-frequency sounds which occur in systole, either mid, early, or late. The click generally occurs at least 100 milliseconds after the first sound. The most common cause of the click is mitral valve prolapse. The clicks of mitral origin are best heard at the apex, or toward the left lateral sternal border. The click will move closer to the first sound when volume to the ventricle is reduced, as occurs in standing or the Valsalva maneuver. When ventricular volume is increased, as in squatting or bradycardia, the click will move farther from S1. Listen now as a click is introduced during systole and then withdrawn. The next example is that of a normal 20-year-old female with a typical mid-systolic click.